Okay, well, welcome everybody. Thank you for joining us this afternoon. My name is Bernard Steinman, as seen on the slide here, and I am a faculty member at the university here in Laramie. My co-presenters are Mark Kelly, who is with the Aging Division at Department of Health, and Kristen Glennie, also from the Aging Division. So we are here to talk to you today about home modifications, which is a topic that has become near and dear to all of our hearts, as we have recently begun this coalition called the Wyoming Home Modification Action Coalition. And our main goal, at least early on, is to raise awareness about the benefits and efficacy of home modifications throughout Wyoming. So Mark, you want to switch the slide? So at the university, I am a gerontologist. Most people probably know what that is, but if you don't, it's a person who studies the aging process. I tend to think of aging as a lifelong process. You don't begin aging when you're 65. You start when you are a baby, like the one shown here. And one thing that happens to people as they get older is that they become more diverse. I often joke when I show this slide and say that when you've seen one baby, you've pretty much seen all babies, because they are so similar in so many ways in terms of their functioning, their cognition, things like that. They're pretty much the same. There are some differences, some variation in superficial things like their skin color and hair color and eye color, but otherwise babies are pretty much the same. By contrast, older adults are very different from each other. There's a big range of people's functioning. So in the pictures here, you see people who are active and healthy. Some examples of people who maybe are a little bit more frail, and then some extreme examples of people who are doing incredible things, like the Rolling Stones, who are still on tour, and they are coming up on nearly 80 years old. So there's a lot of variety, a lot of variation in people's functioning. And that's really kind of the crux of our topic, which is thinking about making sure that your home environments match your physical functioning. Next slide. So this slide is depicting a fairly robust finding in research and aging research, which shows that if you ask people about their preferences, the older that people get, they are more likely to say that they prefer to stay in their current residence for as long as possible. This is called aging in place. And as you can see from the chart, it shows that that's true, that the older people are, the more likely they are to agree with the statement, what I'd really like to do is stay in my current residence. Oftentimes that is not possible or realistic or feasible. And so when it isn't, the second option that people would prefer is to stay in their communities. So when people begin to lose functioning, it can be really troubling for people if they're not able to stay in their homes, because oftentimes communities don't have the support that would be needed to keep them in the community. Wyoming's a really interesting place because resources are kind of spread out. If you live in a very small town, somewhere in central Wyoming, if you don't have if you can't stay in your home, that can often mean moving hours from friends and family, which nobody wants to do. Next slide. So we think about this in terms of the preference that people have to age in place. We think about reasons why that might be, and I think if I opened up the floor for comments, you would probably guess pretty closely to what the slide says here. People have a psychological attachment to their homes. People spend, many years, sometimes building and raising families. Their entire lives can be, contained within the home, and so people get this attachment, and that explains why they are reluctant to leave. People feel safe and secure in their homes. I always talk about the example of when I travel, which isn't often, but when I do, it is always a big relief to get back to my house. It always feels good to be home. There's familiarity with your home and the neighborhood, so you may have idiosyncrasies in your home that help you to function better. things that you know and that others might see as a hazard, but that you know are helping you to stay there. So that familiarity is also important. And then, of course, the proximity to people in your social orbits, the people that you care about and the people that you exchange resources and help and all those things. Having relatives and friends nearby is also important to people. Next slide. So I show this picture. This is a picture that I don't think this house is in Wyoming, but it certainly could be. This is a fairly common housing style. When we're live, I usually ask the audience to take a guess about when this house was built. And generally the guesses range about maybe midway through the 20th century. And we all know what was going on then. There was a baby boom going on. People were starting families, having lots of children. And this style of house obviously shows that it was built during a time or designed during a time when people weren't really thinking about an aging population. Of course, now the baby boomers, every day 10,000 baby boomers turn 65, and our population is rapidly aging, and housing like this is not as useful as it used to be. My mentor calls this Peter Pan housing. That is housing for people that never plan to grow old. It has features that if I asked you, you would probably pick out, such as the front steps. If you couldn't do steps, it would make it really hard to get into your own home. If you couldn't do steps, it would make it hard to get out of your home. So housing like this can result in isolation if we don't start thinking, or if we don't think about modifications of some kind. There, in all likelihood, are also bedrooms on that top floor, which, if you couldn't do steps, it would make the top floors of the home useless to those who lived here. So the house has lots of features that make it evident that it was not designed with older people in mind. Next slide. So what we are trying to do is promote what we call supportive home environments. So supportive home environments are environments that are designed or modified to help meet people's changing functioning. We talk about this in terms of person, environment, fit. So what we're really looking for here is making sure that the environment changes along with the individual. In other words, if we have to, we want to talk about modifying homes in order to address some of those barriers that I talked about earlier. Why this is important? It's because homes are where people spend most of their time. We want to preserve people's quality of life, or help preserve people's quality of life, choice, and control. We want the changes that people can benefit from to be their own choice and not something that's inflicted upon them. We want to make caregiving easier. So home mods, really, the benefits go beyond the individual. They also go to somebody who's helping the individual with daily functioning, making that task easier. And probably primarily, we're looking at trying to prevent accidents. I'll talk in a bit about falls, but just as a preview of that, about 1 out of 3 older people fall every year, and that results in serious injury and oftentimes in accidental death of older adults. So this is really a priority, not only on a human basis, but also on a policy and cost basis. We want to be thinking about how to alleviate some of these issues. So supportive home environments are really central and a cornerstone to this idea of aging in place. Next slide. So as promised, here's my slide on falls. If you want to hit the button mark, it will turn my little person. There we go. There's our faller. The 1 out of 3 falls annually, and about 20 to 30% of falls result in an injury, in serious injuries leading to hospitalization and so on. So this gets to be a really a painful issue for individuals, but also a very expensive issue for agencies and organizations that pay for these things. Next slide. This slide is showing the incidence of falls by age. And as you can see, there's a small spike in the teenage accident-prone years when kids are doing things that are maybe a little bit wilder. But for the most part, people are much more likely to fall after age 75. So there's a giant spike in the later age groups. Falls are caused by multiple different factors. Usually there's not one thing that causes somebody to fall. Generally, we think about falls risks in terms of intrinsic risks, which are things that are within the person. So maybe a visual impairment would be an example of an intrinsic falls risk, or some balance impairment, something like that. Falls are also caused by behavioral risk factors. So these are things that people do that they maybe shouldn't do, that place them at risk for falling, and things that people should do that they don't do. So taking certain precautions to prevent oneself from falling. And finally, once again, the crux of our discussion are extrinsic fall risks, which are things that occur in the environment. Once again, usually these things are not acting alone. Usually there's an interaction between these three categories of risk factors. Next slide. So this slide shows a simulation that is designed to give you an example of an intrinsic fall risk factor. So this is my late doggy Coco, who used to walk with me on the docks when I lived in Providence, Rhode Island. He would walk with me on the docks, and we went there to walk, but others went there on Saturday afternoons to get on a ship that would take them out to the islands. So it was a cruise ship essentially. I don't know what it is about cruise ships, but they often draw older adults, I guess because they're retired and want to do things like that. So every Saturday when we would be walking down by the docks, there were loads of older adults lugging their luggage down to the ship. I don't know if you can see, but this picture is showing you a set of about 4 or 5 steps, which if you had normal vision would be very difficult to detect. Even somebody with good normal vision would need to rely on other cues in order to notice that there were steps there. One cue being the railing in the background shows a downward slope. So that would tell you maybe that there were some steps there. But otherwise not very easy to tell. If we show a simulation of, I believe it's macular degeneration. Nope, sorry, cataracts. So cataracts occur when people's lens fogs up and it makes an image look somewhat like this. And you can see Coco is still evident there. You might recognize that as a dog. The steps that were already difficult to see are even more difficult to see. Vision impairments certainly don't make it easy to detect things that you could use to assure your safety. Let's add on to that macular degeneration, which is the degeneration of the cells in the middle of the retina, which detect details. And you can see that Coco has become basically a smudge. He now is a trip hazard, and the steps, of course, have not become any easier to see. And lastly, glaucoma, which is an eye condition where individuals start to have tunnel vision. And here you can see that really no other clues about the steps are even present. Coco's, all you can see of him is his tail, and the railings are gone. And once again, if you just saw that, you would think that was a flat surface that you could walk on without any difficulties. So vision really is a common falls risk factor that places people at risk for this reason, that it can include information that would be useful for preventing falls. Next slide. Here is an example that probably most of us can relate with. This is a risky behavior. This image was taken during an assessment. And in these assessments, what an occupational therapist will do is ask the individual to perform a task that they need to do in order to live independently at home. And this person was asked to show us how you would cook a pot of spaghetti. So she had her something stored up there, a pan or the noodles or something, but she just walked over and grabbed that footstool and propped it up and climbed up there, because this is what she does. This is how she does it. All of us have these behaviors, which if you're from her perspective, it just seems like a normal everyday activity. For others, including the occupational therapists, it was identified immediately as a risky behavior that could place this person in danger. Also, I have the word family there. This woman's son was present during the assessment. And when he saw her doing this, he lost his mind. He said, I cannot believe that this is how you are doing this activity, that this is how you're living. He was very fearful for her safety, as he should be. This is not a good remedy for, or a solution to cooking a pot of spaghetti. Next slide. Of course, we are interested in the environment, and as I said and have just shown, the environment interacts with these other factors. But so why are we so interested in the home? Mainly because homes are where the majority of falls occur. 55% of falls occur inside the home, which makes sense, and 23% occur outside the home, but near the home. So out on front steps or those types of places. So there's a lot of time spent in homes, and therefore homes are where people fall. And so it is a logical next step to think that this would be a good place to begin addressing falls. Next slide. Fortunately, we have identified, I guess you should say scholars have identified very common places where people are likely to fall. And here are some examples. You can look at the pictures and maybe think of why these pictures are risky, or why these places are risky. The man on the left is going from a dark inside location into the bright sun, which if you've got aging eyes, you probably can relate with that you basically get blinded when you go outside. It takes your eyes a minute to adjust. The steps are not marked, even with my fairly decent normal vision. It's hard to see that there are steps there. And even if the steps were marked, there are no railings. It would be nice to have a railing down the center and also on both sides so that the gentleman has something to grab onto. Inside stairs are also risky. This picture, I think, is not uncommon. It's a bit dated, but I think there are many houses that probably still look like this. Housing with that old style of shag carpeting on the steps, which after decades can wear down and become really slippery and dangerous to go up and down. The other thing that I usually don't tell people until after they've kind of looked at the picture for a bit is that this gentleman has had a stroke previously. And so the reason that he's twisting the way that he has a limited use of his left hand. And so in order to use the railing that is available, he has to twist in order to grab on with his right hand. So one solution to that would be just to have rails on both sides so that he can go up and down easily with some support. That stairwell is also extremely dark, which also is an issue. Lastly is the picture on the right showing unsafe bathrooms. Once again, I'm sure everyone relates with this. Who hasn't grabbed onto a towel rack and thinking that it would function as a grab bar? Well, towel racks are not designed to support a person's weight. Neither are soap dishes and tubs. Both of those things will easily pull out of the wall, and I always cringe a little bit when I see this picture, imagining that gentleman going headfirst into the tub. So if you do that, don't do that. Don't grab onto towel racks. Consider modifying your home with some grab bars that are screwed into the studs of the wall and therefore won't come out. Next. Home hazards also are a common falls risk, environmental falls risk. This is not my late father, but it looks like my late father. I think many people can relate to having a control center like this where all of your stuff is, your phone, your radio, your hobbies, all of your stuff around a place where you like to sit, which is fine. It's good to be comfortable. It's good to have everything you need. But as you can see, there's lots of clutter, lots of wires there. The footstool probably is a risk factor for tripping. And so if you're going to have the stuff, it's probably best to think about stowing away the clutter so that you don't trip and fall. Next slide. Well, I think this picture speaks for itself. I won't say much here. Pets, we love them, but they tend to lay down in places that could be dangerous. So beware of the dog. Beware also of the basement steps. Usually basement steps are not in the best condition. And so therefore we have this cartoon. Next. All too many homes in the United States and Wyoming have unmet needs for features to address the issues that we just talked about. This data is dated, but at the time, 1 million households of older adults had at least one functional limitation with an unmet need for home modifications. So they needed grab bars, or an OT would have suggested that they get grab bars, but they did not have them. So the need is very great. Also, next slide. We talk about home modifications in terms of these 4 categories. Or is it 5? 1, 2, 3, 4, 5. 5 categories. Forgot about rearrangement. Home modifications, I think an important point that we would want you to take away from this talk is that home modifications vary widely in terms of their size and really the effort that it takes to install them. Additive features can be relatively easy to put in. Additive features are just simply adding something to the environment, whether it's a grab bar, assistive devices, or most importantly and most easily, better lighting. It's always relatively easy to improve lighting. Subtractive features like removing hazards, as I just showed you. Behavioral risks, so doing your best to avoid risk, trying to find alternative ways of doing things so that you don't have to pull a stool up and climb up as that woman was doing. Rearranging is an option. Sometimes when things are cluttered, the easiest thing might be to clear a path. We need to be somewhat careful when we do this. If you have a professional helping you, it can be disorienting for someone if a piece of furniture that they were using to orient themselves or to balance themselves is suddenly moved somewhere else. So this would definitely need to be something that would need to be done in collaboration. All of these things really should be done in collaboration with the resident, but certainly rearrangement is also an example of that. And then lastly, our transformative home modifications, and these are things that are pretty major renovations. I'll show you an example of that in a moment. So just quickly, I can buzz through some slides here that show examples of these things. So here's our friend using the soap dish, and one of the things that an OT might recommend is grab bars. I should say, and one of these days we're going to update these pictures, but these grab bars are not modern. Nowadays, I don't think that anyone would recommend one of these suction cup grab bars because they also can just slip right off, or anything that's sort of pinched onto the tub. Those types of things aren't as highly recommended. Generally, what you would want is a grab bar that, again, is affixed to the stud in the wall. Next slide. Lighting, as I said, easy to fix. All you need to do is go down to Walmart or Safeway. Probably isn't a Walmart in Jackson Hole, I would guess. But better lighting can improve one's quality of life and make one's perceptions much brighter. Next slide. Clutter, once again, so these homes are probably not unfamiliar looking for most of us. This could almost be my house at times. Easy to recommend, sometimes difficult to enact, cleaning up an environment like this, but there are definite benefits to removing clutter. Next. So this is a common one. All of us love our rugs. Rugs make our homes more attractive, but they also place us at risk. The rug on the left, you can see is raised a little bit. It's wrinkled and folded up, and even something as small as that can be a trip hazard. So if you're going to have rugs, it would be beneficial to make sure that they're affixed to the floor. Once again, so this is an example of an additive, or this is a subtractive. So we're recommending either remove the rugs, or if you don't want to remove your rugs because you spent good money on them, then at least make sure that they're affixed and aren't going to pop up for a trip hazard. Rearrangement. So this woman was demonstrating how she cooked a pot of spaghetti, to extend that example. And she has all her pans stored below her counter. And so in order to retrieve them, she needed to bend in a way that was uncomfortable for her. The recommendation that was given is not all that attractive, but it solved the problem and made her life safer. So you see that now the pots are hung on the wall. Next. Here's another example. I use this slide to make the same point, but also to point out that design has gotten much better. This picture is pretty old as well, at least 10 years old. And every year there are new modifications and new styles that are being used to make modifications and to do it in a way that doesn't look even more like an institution. We don't want to turn people's homes into nursing homes or assisted living homes. We want homes to feel home-like. And so design is a big part of that, achieving that goal. Here is my example of a transformational home modification. So the gentleman shown is the father-in-law of my mentor, who came to live with my mentor. Fortunately, my friend had space in his backyard where he could have a flat for his father-in-law. And you can see some of the features of this space that are that address some of the physical limitations of the elder. Namely, you can see the grab bars, which are installed correctly in high contrast to the tiles. If the tiles were white, you wouldn't really even be able to see the grab bars. There are non-slip tiles on the floor, and also no edge to step over. The gentleman in the previous picture by the tub would need to lift his leg over the edge of the tub. This gentleman can walk straight in. There's a shower chair. The water nozzle allows him to get the water where he needs it. He doesn't need to move his body. He can just move the nozzle. There's an anti-scald device on the nozzle. Older people, as their skin changes, it makes it harder sometimes to detect when injury is being done, when they're being burned. And so making that impossible to do is one solution to that. So there's a lot going on here. This would not, if you didn't have this already, it would not be inexpensive. That's why we have categorized this as transformational. It's basically transforming the environment. Next slide. So we three recommend that individuals take a look around them when they are at home and think about the things that might be placing you at risk for a serious injury and that could place you at risk for an alternative that most people don't want, which is going into more intense care levels. There's lots of little checklists out there. In fact, if you Google "make your home safer" with CDC, you'll get this checklist for safety, which will give you a walkthrough of your home, and you can just go through and make sure that your home doesn't violate any of the known issues that cause people to fall. That should be free online. Next slide. Next slide, and my last slide. So as an academic and as a social scientist, I'm very interested in knowing that these things work. There's lots of evidence to show. I've been reading a lot of papers recently about the effectiveness of home mods in reducing falls. There's a range from about 20%, a 20% reduction to about a 60% reduction, depending on different situations, like whether or not the person has fallen in the past. So home modifications, we know that they work. We know that they reduce falls. And so one of the things that we've been doing as a coalition is thinking about how we can widely implement home modifications or encourage people throughout the state to modify their homes for their own safety. And with that, I will pass on to Kristen, who is going to tell you about some of our program efforts and some of the things that we're trying to do here in the state.
Kristen, we can't hear you. I don't know if it's just me.
I can't hear her either.
No,
Can you hear me now?
Yeah,
Yes.
there we go.
Yep.
Okay, awesome. Yeah, so one of the programs that we've been looking at as we are trying to implement different home modification models is this one called Capable. It was founded out of Johns Hopkins School of Nursing, and it's essentially a falls prevention program that involves an occupational therapist, a registered nurse, and a handy worker. So this, I like to call them the trifecta or the triforce, what have you. They are helping out older adults, essentially by combining forces. So, right, the occupational therapist is able to do a home walkthrough, which is essential for home modifications, especially the larger ones. And it just really helps people understand what they need and what will best help them stay in their homes. The second piece of this is the RN, who's able to go in and do mental health management as well as medicine management, and just figure out the best way to monitor your physical health to best stay in your home. And then the last piece, which I think is really essential and a key part of this program of what makes it so successful, is that it involves a handy worker. And so this person works directly with the occupational therapist to go in and make those specific changes, like the big changes that you might not be able to do yourself. And just having that unified structure is really efficient in helping people stay in their homes. So this program, as you can see in the bullet points, improved ADL and IADL functioning by 79%. And there's also potential cost savings by keeping people out of nursing homes for longer, and improving mental health, which is fantastic, especially as we come out of the last 2 years. So if you could go to the next slide, please. So this is just a breakdown of what the program actually entails. It's a 4-month intervention. So the registered nurse, the handy worker, and the OT all go in on a rotating basis. The occupational therapist does 6 visits, the RN does 4, and the handy worker goes in until the job is done, given a $1,300 approximately budget, depending on your area and et cetera. So I think one part that makes this really effective is that the occupational therapist and the RN work together, which can be kind of tricky, just again, finding that unified force to help people. And the total cost of the program, it's been implemented in a fairly wide variety of places. This graphic might actually be a little outdated because it's really come a long way. It's popping up all over the country. But usually it's between $2,800 and $4,000 for the total cost of the 4-month intervention. Next slide, please. And then here's a breakdown of the numbers. So I mentioned there were some associated cost savings. They've run this program as a matched comparison to Medicare. So this graph in the bottom right-hand corner is showing the matched group, which is just people that have standard Medicare compared to people who had the capable intervention. And it showed quite a big savings gap over a 2-year period. which is really helpful, just trying to implement this more broadly and working with outside sources to get funding. There's really, not only is it great for the individual, but there's cost savings for the state. So up in the top left-hand corner, there's also graphs depicting the ADL and IADL improvements. So 74.8% of people improved on IADL limitations before the after the program, and then for IADL limitations, 63% improved. So yeah, it just is really great all around. And if we go to the next slide, here's a list why. So as Bernard mentioned earlier, it's really about the person environment fit. And this program specifically targets that. So the occupational therapist is going in and asking the older adult, what do you want to be able to do in your home? So there's the ADLs, which are just activities of daily living, but the IADLs, I think, is really what boosts this program, because that's focusing on what the person wants to be able to do, whether it's making a pot of spaghetti or walking their dog. And that really helps to improve motivation. Like once you accomplish one goal, what can you do next? And then, yeah, it's just really building self-efficacy and maintaining that momentum, which can be really helpful, especially in terms of mental health. If we go to the next slide. So this is a graph that was on the website. I believe there's more now after this recent round of funding through the federal government, but the program itself is really expanding. I know there's some in Montana, in Alaska, and Colorado. So all areas fairly similar to Wyoming. So the question that we have is, can we adopt this in this state? Can we adapt it to Wyoming to meet our specific needs? What about it works, and what about that can we continue on for our own home modifications and improving that throughout the state? Yeah, so fingers crossed, we're still working on it, but it's a great model. And even if we don't end up implementing exactly this, it's really a great way to think about home modifications and how they can actually be applied to help people long term. So with that, Mark, I'll pass it over to you.
Wonderful. Thank you, Kristen, for that part. And so my part of this presentation is now about the actual implementation of that. What we've heard about the different types and the theory. We've heard about a potential program that we are looking at and we're hoping we can implement in Wyoming. But the next stage is we're looking at what are the barriers that we're seeing right now, what are some program challenges, and what we're trying to do to overcome those. So from this graph here, you can see where it says, why don't people want to make changes to their homes? Because one of the barriers that we have seen is that it is from the older adults themselves not wanting them, or there's some barriers in place that are stopping them from getting these home modifications. And the biggest one that's on there is obviously being unable to do it themselves, makes them not willing to look at the potential for getting these home modifications. The affordability aspect, some of these prices seem, even now, have seemed relatively low. Sometimes the cost of home modifications can run into several $1,000s. And obviously that's for the more transformational side, but even for the lower end, the time for contractors, the labor, everything is going up. And so cost is a big factor. Finding trustworthy and good home contractors is hard. In our state, where we have low availability of contractors, it is a challenge to find the right contractor who's willing to do smaller jobs per se than maybe the larger construction jobs that they may be used to. So that is a challenge. Also, not knowing what kind of modification will work for them is another barrier, because as Bernard mentioned, there are 5 different styles and types of home modification. Not all of those will be suited to each person. And so obviously they go up in terms of scalability, in terms of what is done, to the highest to the smallest things like changing light bulbs and put better lighting in, to the larger things like stair lifts, ramps, and remodeling bathrooms and kitchens. Also, sometimes there's a lack of availability of contractors in general, not just good ones, but contractors who can cover areas that is an issue. And finally, obviously, the aesthetic appeal and not wanting to have your home look like an institution or hospital. And so, and there are design features that can be made to make it less like a hospital and keep your home aesthetic as close to the original as it used to be. These are meant to be the little additions instead of turning your home into a hospital. So those are some of the barriers in place. And in terms of excuses that we hear, here are some examples. So I know I shouldn't have that throw rug on top of my carpet, but it's hiding a really bad stain and I don't like to see that stain. Can't get rid of that stain. So I put the throw rug on top. That may be the case, but it's also a trip hazard and it puts the older adult at risk of a fall. And the second one here, I am very interested in this home assessment thing, but have to clean my house first. Worried about how your home environment looks, but that should never be a deterrence from getting a home modification, because that's part of the help that can be offered, is to help to get the home environment safer, quicker. So, and the last one, I will wait until I really need it. That's probably one of the worst excuses on this list of potential excuses that we hear, because you need it before you get to the point that you really need it in order to make sure that transition is safe. Rather than you have several falls and you're obviously in and out of hospital for those falls, and then you do need that to happen, and it's there's less time to adjust and there's less time to plan and to make sure it is how you like it. So those are some excuses that we hear a lot of. So some of these program and policy challenges, one of those is the lack of awareness from older adults and caregivers of the work that can be done. And again, there's 5 different types: the additive, the subtractive, and the transformational, and the other 2 as well. The shortage of professionals, as we mentioned, it is a challenge in our state, and that's not going to be addressed overnight. It will be a process. It will be a process of building awareness, not just with older adults, but in the community, so that young people who are contractors can see that there is a market and jobs out there, so there'll be more people to do the work. So this is a growing community, a growing effort, and something that we do need to address. With retirement planning, not being able to see the beautiful home that you probably have right now may be a Peter Pan house that's not going to assist you as you go into your later years to get the right environment. So being overlooked in retirement planning, and not enough coordination with healthcare professionals who know your situation, who know your needs. The more involved they are, as we've seen, Kristen mentioned with the Capable program, the better your home environment will be to enable you to age in place. Difficult to access products, as we know after this pandemic, the availability of materials, lumber has doubled in price. That's an issue. Materials that are probably manufactured abroad, taking longer to get here, costing more, and lots of supply chain issues, and the pandemic has just exacerbated that issue. And that's not going to change anytime soon, but it's something we do need to work at. And the last one is the inadequate or unreliable funding, and not knowing what the funding is. So these are the challenges that we face. So being aware of these problems is good, so we can look at the solutions. One more area of interest is, if you take a look at this list, not going to go through all of those, but you can see the examples of the types of people that can be involved in a home modification. With Capable, obviously they're looking at just 3 types: the OT, the nurse, and the handy worker. But there are also other people who could be involved: architects, the clergy, and the local community, housing developers, realtors, social workers. And all these different people need to be brought to the table to help the client's needs and help that home modification be the best that it can be. And that is difficult. It's difficult to bring all these players to the table when and where it's needed. The more awareness that there is out in the communities of home modification, the better this situation will be in the long run. People will be more willing and able to work together for the needs of older adults. So what are our next steps? So the first step is to recognize housing's role in fall prevention, long-term care, and health. So that means not just the housing stock that we have now, but how homes are built in the future. One of our steps is to start to communicate with housing developers to see what plans they put in place to enable those homes to be aged into, and not just fixed and remodeled afterwards. Not a reactive, we're looking at a proactive approach as well. Obviously raising awareness of home environments and building better new housing, trying to build that awareness now with everybody here on this video call today. We are seeking to implement these evidence-based programs that have been proven to work, such as Capable, in order to get the best results quickly. So we are in the middle of seeking funding for Capable, and if that doesn't end up working out, we will be attempting it again, because these things just need to move forward, and that's what we're doing. We're also increasing home mod training of professionals and providing a platform for discussion, and we'll be talking about that in just a moment as well. And encourage innovative funding via tax credits and other such avenues and loans and so on. And lastly, changing codes to require UD features in new housing. So there's a lot of things that we are looking at doing as potential ways to fix this problem, but those are long term. And so in the short term, as we mentioned before, the Wyoming Home Modifications Action Coalition, and Kristen or Bernard can type the website into the chat box so people can look at that later. That would be great. So we, after we completed the state plan on aging, all three of us here who presented in school worked very hard on the state plan on aging, and one of the areas that came up was a need for home modifications, was a need to age in place. And one of the things that we noticed is that not many older adults and caregivers knew about the term home modification. They didn't know really what it was entailed. And so from that awareness and the awareness that people do really want to age in place and they want to stay with their families, friends, and communities, from that evidence that we saw in our community, in our state, we formed this coalition with a large array of other groups, including building contractors, independent living organizations, and many others, and also university groups attached to University of Wyoming. So we have lots of people interested in developing and putting forward home modifications. And so part of our vision statement is that we also want to see more successful home modifications across the state, and we are still working on pushing that forward. But we are building this unified network of contractors, professionals, organizations, academics, and our clients who end up receiving the home mods. This network of people who are aware and pushing forward the agenda of home modifications. We are hoping for targeted research. So our team, if we do receive funding soon, we'll be looking at what we can do to research what works well, what works, what needs to work better in Wyoming, and just make this process better in the future. The repository of information we have got now with the website, which Bernard's put on the chat feature, and we'll click on that later and show you what that's all about. We're looking for a central place where people can find out where to go for funding sources. And one of the things that we are doing is a quarterly presentation at 9 a.m. on the 5th of April, I believe. Bernard or Kristen, correct me if I'm wrong, it's the 5th of April. There is a Zoom link that you can receive from any one of us, and our contacts will be in the chat box or on the website. You can find us, we'll send you a link, and then you will see some news, which we don't have time to fit into this presentation today, but there is a lot of developments already with moving forward with resources and publications and consolidation of where to go for these home modifications. So there is a lot of action going on in our Action Coalition. That is part of our training focus. We do want to train the contractors and sub-recipients to be better aware of home modifications and what to do, and of course raising awareness with everybody, which is what we're doing. So, and Bernard has put into the chat as well that UD, as mentioned here, is the universal design features. that works for all people. And the last slide in our presentation, which will close out this presentation today, is an example of one program out of about 17 or 18 that we know of that provides home modifications to different levels. One program is actually the program that I manage at the state, and it's an example of what is out there and what can be done with home modifications. So we wanted to present just one example here. So with the new IRAP, the Emergency Rental Assistance Program, there is the Housing Stability Services portion of that, which is designed for older adults and adults with disabilities. For those older adults and adults with disabilities who have gone through IRAP and have been approved for IRAP. If you've been approved, then the next step is that you can apply for services such as home modifications and trailer mobile home repairs. Trailer repairs are obviously not modification of the environment. They are trying to keep the structural integrity of the home, which can also then put in place the basis and the foundation for good modifications to make sure it's safe, to prevent falls. So they are kind of interconnected, and we've seen a lot of that. If you are in a trailer mobile home and it's in disrepair, then the chances are it will already be unsafe for you and be trip hazard by that very nature, whether it's a leaky roof or the subflooring is caving in, or there are plumbing issues and so on that can cause further issues, making it unsafe for, when you breathe in, or if it gets moldy and so on. So we've got these two services as part of that program. The limit, as it stands right now, is at $5,000 per service. So $5,000 for home mods and then $5,000 for trade repairs. And it is very much an open book between what the care manager and the client come up with. Well, what is needed in this situation? It is not as advanced, and it's certainly not an evidence-based program like Capable, but it has the aspects to enable that to happen. And a lot of these other programs that are out there, like mine, like ours here, they do similar things to that. And obviously, there's a lot of different ways of completing a home modification project. Some of them are better than others, so we should say, and obviously the best ones out there will be evidence-based or evidence linked to evidence-based programs, because that's where the evidence is. But everybody else is doing their best and filling in gaps in the community, and such as this emergency rental assistance program as part of the pandemic. And this is what we've come up with. So if you are interested, you can go visit the health.wyo.gov website and type in IRAP/HSS into the search. You'll find the magnifying glass, search and type that in. You will find the page, and then all the information is there, and all my contact details are there as well. So that is our presentation portion. We'll be stopping the recording in just a moment, and we'll be opening this up to conversation from everybody. We want to know what you think about what we've talked about today. Maybe if you are wanting to talk about more of your own situation, if you want to in the public forum, then feel free to. Or if you want to get more information about other programs, we can look into what we can see and also show you the website that we have created with more information. So Bernard and Kristen, is there anything else you would like to add before we close the presentation portion of this presentation? No? Okay, well, thank you everybody for joining us on our WyHMAC presentation. And I'll start recording now.